Good morning, Jeff. Thank you for coming. Jeff from the Northland District Health Board, who surprised a lot of us with results last week about a new study on leptospirosis. Take it away, Jeff.
Okay, this is some wonderful work done by Massey University, and these are the initial findings. Can we go to the next slide, please? Okay, I'll just explain what I do very quickly. I'm a Health Protection Office, Public Health Officer. In the context of pest control, we have a responsibility around issuing of permissions, if you need a permission on public land, or docs, not who we normally deal with, but also we investigate infectious diseases, particularly notifiable diseases like leptospirosis, which is the topic of our conversation today. So next slide, please, just get me out of the way here. Now, the information presented today is sourced from Massey University, and I had a long conversation on Friday with Jackie Benshop, the lead researcher, who is completely enthusiastic about continuing this work. She has a couple of colleagues as well, and very much enjoys working for Regional Council. So we're going to, hopefully this will be fruitful going forwards. Next slide, please. Okay, now leptospirosis, as you'll see on the slide, causes flu-like illness. This can lead to hospitalisation, and you can see the stats here. And sometimes there's a chronic illness develops. I personally, it's an instance where an acquaintance of mine was ill for years before it was diagnosed, and he put it down to a great many other things. Now, the common symptoms sounds almost a bit like COVID, but worse in some ways, depending on your level of COVID you get. Some of the other symptoms are bloodshot eyes and bleeding nose if you get it really badly. And an acquaintance of mine who I recently interviewed, he's a big, strong man, and he went down big time. You'll see the number of species we have here. The possums were the constant on the study. The conversation I had with, what they haven't included in here is pigs, which are another host carrier. And they are also going to be subject to further research, hopefully, if it all pans out. So they're another big host. Next slide, please. Yep. Right. You'll see here, we've only got fairly low sample numbers. So that's why it's an initial study. But if that holds out, if you're handling possums, you're potentially being exposed all the time. And if you go on and look at the mice and rats here, they've also got a high level of infection. And mice and rats do cover other illnesses, which I'll talk on a bit later on the next slide. So you can see if 86%, if this holds true, 80% of possums being infected with lepto, if you're handling possums, especially if you're skinning them, if you're just disposing the carcasses, your exposure may be less, but it still puts you at risk of catching it. Okay, next slide, please. Yeah. I'm trying to keep, right, just to understand, where the lepto is found is in the kidneys and in reproductive tract. It is also shed into the environment through urine. And I'll discuss the consequences of this a bit later on. The other aspect is that it can be passed from species to species. So it's not only protecting ourselves, it's preventing, by reducing possum numbers as we're doing, or disposal of offal and use of offal. It's really important we take utmost care around the handling these animals and their carcasses and what we do with their remains. Next slide, please. Yep. Right, this is really getting down to the nitty gritty. This I'll discuss a bit more than lepto in here, but leptospirosis, if you're handling animals, the general mechanism it gets in is through broken skin and mucous membranes. Now, your mucous membranes, lining of your nose, around your eyes, inside of your mouth, type things. So I like to think of also being a bit of a, not so much bum to mouth, but bladder to mouth type illness as well. So this is where, as your mother or grandmother probably harped on about it, wash your hands. Wash your hands all the time. Wash your hands any time before you go eating food. Wash your hands, clean your hands if you smoke. Don't go around sticking your, rubbing your eyes and sticking a cigarette in your mouth. That type of thing. Any damage to your hands, wear gloves. And even preferably if you're doing fur plucking and other things like that around possums, wear gloves. If you're breaking down a carcass, wear a glove that protects you from cutting yourself. If you're skinning, same thing. Can you imagine a leptospirosis and you actually cut your hand while doing that? It is a pretty direct way of infection. Now I'll just mention one or two other diseases quickly. Rat bite fever. It's quite uncommon, also known as spirolysis, and that has quite severe symptoms with hospitalisation. They're not a common thing. However, it is there, and the same protections applies: washing hands and wearing gloves. Tuberculosis. Thankfully, I don't believe we have tuberculosis in possums up here, but it could always arise. And you skinners down south have got tuberculosis in the skin on their hands. Seen photos of that. It looks particularly unpleasant. Dogs can get it as well, and they look like they've got the worst case of mange out. Ringworm fungal infection, that's probably the least harmless of the lot here. Now, next slide, please. Here. Right, just as I already stated, be careful around rodents, wildlife, urine, all that type of thing. Emptying your traps. I sometimes, with my Steve Allen cat traps, will actually push the animal out with a hunk of stick after I've levered it back, just to minimise my contact with it. The other important thing is lepto can survive on water, mud, moisture. It's environmentally, and like I said before, if you're getting rid of carcasses and stuff like that, keep them away from waterways. You're supposed to keep them away 50 metres away from waterways anyway under the DOC rules, not DOC rules, sorry, the Regional Council rules. If you have an offal put, bury it. I know it's not possible. Keep it away from people, basically. Vaccination for livestock and dogs, really important, especially if you've got a dog that does pest control work. You don't want it becoming unwell. And really importantly, and this covers any other advice we give to people when we're doing infectious disease investigations: if you're unwell, go and see your doctor, because this is something that could mess you up for a very long time, make you really ill, and actually take you out of work for some time. Righty-ho. And if you want any information around any infectious diseases, get hold of me or one of my colleagues. Now, move on to the next slide. That's, I think we're getting righty-ho. Prevention, like I've been harping on already, for hand washing, food safety. That's, in this case, that's a whole wider topic, but in this case, is washing your hands, changing your gloves, taking your gloves off before you feed yourself. PPE, gloves again. I don't think there's particularly any need for masking for this illness particular in case or any such thing. Clean your gear, because that will carry the pathogen on it. Your clothes, if you've for some reason had a bladder, animal's bladder pierced it when you're skinning it or whatever, that will have effectively dumped a whole lot of lepto over you. Keeping it to yourself, this is where I'm talking about vaccinating your animals. It's also around disposing of the offal or the carcass itself in a place where it's not going to have contact with people or other animals preferably. And I've talked about the vaccination of cattle and dogs. Again, the dogs, they do not, I understand, pass it on necessarily. They're a bit of an end host like humans. that's a whole big debate discussion though. Right, if we could move on to the next slide, that would be good. Righty-ho, cleaning your gear, change your clothes before going home. You don't really want to bring into the house a whole lot of lepto, and that goes with a whole lot of other pathogens you can carry home and into your house. Salmonella. Case I was talking to his wife actually. She was most unimpressed when he walked into the house covered with the carb scouring. That was very visible. Lepto isn't visible; it's invisible because of urine based. Cleaning your equipment, all the standard stuff. Clean inside your car if you've had chucked a whole lot of possums in the boot. And if possible, keep your working gear separate from home and recreation stuff. They're incompatible, basically. You don't want a small kid getting lepto, bad enough for an adult. Next slide, please. Yep. Okay. Again, there's all the types of things you can use around cleaning, keeping your hands protected. As I said, the face masks is probably not as applicable in this case, but there are other cases where you would wear one if you're around compost a lot, prevent Legionella. The first aid kit, make sure you know how to use the stuff in it. It's already good having these fancy bandings, tegaderm and stuff like that. Are you familiar with how to put them on? Go to a first aid course, and that would just be a generic good idea. Right, next slide. Yep. Now, when we don't mean this, when you, I can't remember where I got this from, but I have seen similar things done. It's know what you're doing if you injure yourself, especially cuts to hands around lepto. Right, next slide. And that's it. I don't want to take up too much time, but the message is, and I'll repeat, wash your hands, use gloves. That seems to be the main route for grazed skin. One of the cases I did interview, he had been kicked by a deer in its last throws after he'd shot it. And that's what we put it down to him getting, where he got it from. Okay, I'm quite happy to take questions. I know that was a bit of a gallop through, but any questions, I'm more than happy to answer.
Awesome, Jeff. We've got about 1 or 2 minutes for questions, and then we'll be going to our first break. So Andy, did you see some good questions come up there? I know Jeff just answered one of them about probably not needing a face mask to avoid leptospirosis. What were the other ones coming through there, Andy? Just 1 or 2.
Okay, thanks, Jeff. I've seen some questions coming through. The use of possums as pet food. What's your comments on that, either licensed or unlicensed?
I deal with public health, so animal health's not my thing, but I would suspect the kidneys are the main thing. And again, I will be, from my perspective, if you're going to use them as pet food, please, if you're breaking and gutting the animal down and skinning it, take all those precautions. And if you've got, I'm mainly feeding a dog, well, get the dog vaccinated, because you don't want to be almost like deliberately infecting it. And dogs, I can't remember off of my the species of lepto they get. Oh, the other important thing to remember, there's lots of different species of lepto. So if you've had it once, doesn't mean you can't get it again. Yeah.
Okay, and another question there. What about hawks and other predating native wildlife?
That I don't know, but I suspect not. I've never heard of birds being affected by lepto or being regarded as a host, or chickens or turkeys. There's nothing in the general handbook we have in information on those types of animals, and hens will have a go at a dead carcass. So it's never come up. If it is quite extremely rare and not significant. Yeah.
Oh, all right. Hey guys, we'll draw it to a close there.